Hello, I'm Dr. Derek Ochai. Today, we're going to talk about why some people feel better following a hip arthroscopy than they ever did even before their hip started to bother them. The reason is something called FAI, or impingement. Here, this is a preoperative x-ray showing someone with cam-type impingement. I've made a perfect circle around their femoral head, and this red circle perfectly matches the femoral head until the bone goes outside the circle here. This is measuring at 80.6. A normal alpha angle is less than 50 or around 50. You can imagine that if this patient were to flex their leg up or rotate their hip inward, that this bone would bang into the socket. This is why a lot of patients have labral tears, is because this abnormal bone bangs into the labrum. But it also decreases range of motion. So it limits flexion and rotation of the hip. After surgery, I have decreased this patient's alpha angle. I took down a lot of bone off the ball side of the hip. This angle is now 50.4. But more importantly, this is not banging into either their labrum or their socket. So not only does this protect the labral repair by eliminating abnormal cam-type impingement on the labrum, but it also allows for more range of motion in the hip, more than the patient ever had in their adult life. So sometimes people have limitations in rotation and flexion, and they play soccer, they do equestrian, they do figure skating or ballet, and they just compensate for this. But their hip isn't great, even though they don't know that they're compensating for it. So after surgery, this range of motion limitation is eliminated. They have more range of motion that's pain-free. That's why some people feel like their hip got better after surgery, even better than it had ever been before. Thank you.